Hospitals also are not the only places scrambling to stay ahead of this threat.
Skilled nursing facilities, assisted living homes, and retirement communities are working on ways to protect their residents, many most at risk. Our Tracy Hinson has more on their effort from Grieve Corps.
We've probably had about 10 to 15 people who have come in today, along with probably 30 to 40 phone calls.
Dr. Sengupta's emergency department has been inundated with people worried about COVID-19, but hospitals are not the place to go.
They should not come into the emergency departments. They should contact the health department and they will provide guidance on how to proceed.
So what if you've shared space with someone who was around a patient with COVID-19? Dr. Sengupta says unless you personally were around the infected patient, you may not be affected.
Anyone else coming into contact with those family members are not at higher risk for COVID-19.
If you have relatives either in the hospital or in an assisted living or nursing home environment, use caution just as if it was the regular flu.
It's the same hand hygiene recommendations that we use for influenza or any viral illness. You want to try and avoid contacts with anyone who's ill.
We spoke with Michelle Blunt, the Director of Compliance and Clinical Services for Del Mar Gardens, who operates multiple assisted living and retirement communities, as well as skilled nursing facilities. Blunt told 5 on Your Side that they've been updating their procedures and sending out new information to their facilities at least daily. They're following CMS and CDC guidance and monitoring changes. Del Mar Gardens and National Healthcare Corporation are some of the local facilities who are asking people with any symptoms of respiratory illness to stay away.
If you have no symptoms and you're not at high risk for being exposed, then you're fine to visit your family members.
Mercy Hospital St. Louis is currently working to set up an off-site evaluation center for people concerned about COVID-19 exposure and who meet specific criteria. We have details on their center. We'll post them on KSDK on the app.